Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
So I'm Joney, Faragher, leader of the Manx Labour Party, and MHK for Douglas East. Yeah, okay. So, to start from the beginning, I suppose the first I heard about this was when I was forwarded screenshots from social media in which someone who said they were a staff member at Nobles had written that elective surgery was cancelled from February. And they'd written that, in their view, doctors would have their workload reduced, and they thought that patient outcomes were seriously at stake. I was also approached by a constituent who said that they've been told by Nobles that there's no funding to treat their cataract and that they'd have to go private to get that treated. So this was towards the end of last week, and I contacted MCALs, but nothing was forthcoming from them, and they've still not responded, actually, despite me chasing that. I was starting to get really worried about what I was hearing, and I did request permission to submit that urgent question about healthcare cuts. The speaker, I know, spoke with the health minister, and he was assured that there was sufficient grounds for that urgent question. And following the publication of that question, I received further messages over last weekend about cancelled or unavailable treatment on Ireland. And equally worryingly, about UK consultants telling Manx patients that they've been told they're not to treat Manx patients anymore because there's no funding. I've received so many of these messages, all detailing different scenarios and all from people who are really worried and upset about this. And actually, if any of them are listening to this, can I say at this point that I'm sorry if I haven't got back to you yet, but I definitely will. And I think that's what we should all remember here at the end of this, is patients, is people with health issues who are being given confusing and alarming information from their consultant, but nothing from government. And that information vacuum from government is unforgivable, regardless of what's happened, how this is resolved from now. It's completely unconscionable that the Council of Ministers haven't informed people of what's happening, and they should answer to the Manx people for that. So, along with the messages I was getting, I was also approached by several staff members from Nobles, and I've been shown the theatre lists for next week, commencing from Monday, the 3rd of February, that show that we've closed 2 of the 4 theatres that we usually have running. So Nobles will only be running 1 cancer and 1 emergency theatre, with all elective surgery being cancelled. I was also shown the media release that I know you've already published, that Mr. Hooper has spoken about. So by this point, I had a lot of assurance that these cuts were not only proposed, but agreed and already actually being enacted. It was a fait accompli, but we've still heard nothing from the Council of Ministers on this. I think what's also really troubling, just last bit, I think what's also really troubling is that staff members are reporting that they feel frightened to talk about this, with some saying that they've been told they're not allowed to talk about the cuts, that they've been gagged, basically. And that's something that I would also expect to be investigated in future, because these staff members have come forward because they're worried about their patients. This is exactly what we want in our medical staff, principals, caring, being willing to stand up for their patients. They shouldn't be punished for this. And I personally would just like to thank all of those staff members who've cared enough to contact me and been brave enough to try to speak out on behalf of their patients, even if they've been told that they're not allowed to.
Let's start with the screenshots, right? So you said you received these screenshots from a member of staff. You've been contacted by your constituents, by members of the public. What does that show or say about transparency? I mean, you're one of the politicians on the island. This is something that you should have known about. But you and Mr. Hooper were on Facebook trying to get as much information as y'all could. It seemed as though the Manx public were a bit more informed than the politicians itself.
Yeah, absolutely. That media release, as you can see, had been sent out on the 15th of January. It was embargoed until the following day, the 16th of January. At that point, politicians were still being told, even a week later, there would be no cuts. No cuts were planned. Obviously, the media release does detail cuts, and we know from the theatre lists that those cuts, that media release was at least in part accurate, because the elective surgery has been cancelled as of Monday, the 3rd of February, according to the theatre lists. So, but again, the MHKs have not been, none of this has been shared. And I think that is so disrespectful to fellow MHKs and other politicians, members of the Legislative Council who are asking questions, as well as to the people of the Isle of Man, who we are there to represent ultimately. And we had no information, and we were being told that there were no cuts planned, when our constituents were telling us, well, I've been told this by my consultant, I've been told this by Nobles. and we didn't have any information. That is an appalling situation to leave everybody in, the MHKs and the people of the Isle of Man. And I really do think that the Council of Ministers should undertake for that never to happen again, and to explain why it's happened this time.
You spoke about the information vacuum and it being unforgivable. How important is transparency? I mean, especially now at this time, the news is coming out. We've been running stories, people who've had their own operations or surgeries cancelled. For the ordinary listener sitting at home and listening to all of these stories, they're going to be afraid. They're going to be concerned and worried. And shouldn't this be the time when you have the health minister or Manx Care or someone giving that reassurance to people?
Yeah, absolutely. And just to go back to your original question there, how important is transparency? It really can't be overstated. People need to be able to trust in their politicians. If the trust isn't there, it doesn't really matter what we say or what we do, and nobody's going to believe it. And to have kind of further eroded public trust in this way, again, I will use that word, it's unforgivable. I really do hope that the Council of Ministers undertakes to take this really seriously from now, get a statement out, an urgent statement out by the end of today, to try and allay some of those fears and that information vacuum, which actually compounds the situation and just makes it far worse for people. The uncertainty for patients, not knowing what's going to be happening for people with health issues, that's not something that we should be tolerating. So I just hope that we'll get some information by the end of today from the Council of Ministers.
Have you tried to reach out to the health minister or council of ministers or anyone?
So as you know, I had my urgent question in. That was my my effort to get the information from the Council of Ministers. It can't be helped, of course, that illness on the part of the minister meant that she couldn't attend the sitting. It's surprising that the other political members of the department, I think Mr. Rashford had leave as well, but that's quite a heavyweight political team in there with 3 ministers. Um, Considering that it's an urgent question, I think generally protocol would have indicated that one of the other political members should have stepped up to try to answer that question. So it's surprising, I think, that wasn't the case in this situation. And I, at this point, we don't know what that shows, but it does seem to indicate that there's an unwillingness to come forward with what's happening. And it just adds to the confusion and uncertainty here, which is not helpful.
Right. And I know you were part of this department a while back. Is this something that, was there even talks about things like this during your time, or is this just something that's new?
Oh, this is definitely not new. As you'll know, both Mr. Hooper and myself spoke about the underfunding of the health service in line with the Jonathan Michael recommendations. So the report did have those recommendations. One of them was a funding formula that hasn't been adhered to. So Manx Care have been tasked with delivering this significant improvement to services, but they haven't been funded to do so. That's really unquestionable. It's a mathematical formula. You can see the funding that they've been given. Now, it could be the case that we are just simply unable to apply that funding, in which case my view is that the Council of Ministers should have then brought that back to Tynwald to be debated and to be re-agreed that we would apply a different funding formula, and we would therefore lower our expectations accordingly of what Manx Care were able to deliver. That's the way that I would think a mature, transparent, open government would have behaved in that situation. Instead, it felt like all we had was obfuscation, where people were saying that, oh, actually, that the funding formula has been applied. We believe it has been. Or sometimes they were saying, well, actually, we just can't afford that. So Jonathan Michael couldn't have predicted these economic circumstances, etc. Different information, different kind of takes on whether we had applied the funding formula or not. But again, that confusion isn't helpful for anybody. We really just need to have that more mature conversation and say, look, if we really can't apply this funding formula, then let's have that open conversation. Let's be honest about that, and let's openly say that we therefore can't expect Manx Care to deliver all of those recommendations that Sir Jonathan Michael gave, because they don't have funding to do that.
Well, I'm not sure if it's who or where, but where do you think the ball was dropped? How should it have been handled? Had it been handled differently, would it have been a little bit better?
I mean, it's all about transparency and honesty, isn't it? I mean, we would expect from a mature, transparent government that they would be able to go to the Manx people and say, look, this is a situation. We're being honest about the fact that we have to make these cuts, or whatever it was that they were going to that they were proposing. We still don't know, and these are the reasons that we have to make these cuts, and we believe in our decision enough to stand up and explain it to you, and we believe in you enough and respect you enough to stand up and explain it to you. That's not what's happened here, sadly.
Going forward, how do you kind of rebuild that confidence of the Manx public?
That is a big question, I think, for all politicians in the future, is how will we bridge that gap between the public and MHKs, all politicians. I think this is going to significantly undermine or erode further that trust. And I really just think we're going to have to commit to being honest with people, even when we think that it might be unpopular, which could have been the case in this scenario, where they were just didn't have the bravery to stand by their own decisions. If we feel like it's the right thing to do, if we feel like we've made the right decision and we've acted in the best interest that we could see for the Manx public, we shouldn't have any compunction in going and explaining that decision. But yeah, as to how to rebuild trust in Manx politicians, I can't answer that, to be honest. It would have to be a collective effort, and a real undertaking from all MHKs and all politicians to be more honest and more transparent.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.